High blood pressure used to be a disease of the elderly, but today, people in their 20s and 30s are being diagnosed every day. Why is this happening? And could you be at risk without even knowing? I am Dr. Josephine, and in this video, I'll explain why more young people are developing high blood pressure, what is causing it, and most importantly, how you can prevent it. High blood pressure, also known as hypertension, happens when the force of blood against your artery walls is consistently too high. It's dangerous because this often has no symptoms, which is why it is called the silent killer. Now, let's break down the real reasons why this is happening. First, silent stress overload. Deadlines, hustle culture, financial pressure. Your body is in constant fight or flight mode, and this keeps your blood pressure elevated all day, every day. Secondly, we have poor diet, fast food lifestyle. Instant noodles, fast foods, snacks. Most young people are consuming dangerously high levels of salt. Many young people today rely on processed foods high in salt, unhealthy fats, and sugar. This directly increases the blood pressure over time. Too much sodium raises the blood pressure silently. Then we have physical inactivity. From office chairs to phones, movement has reduced drastically. A sedentary lifestyle weakens your heart and blood vessels. We sit more than ever, working on laptops, scrolling through phones, and even watching screens. A lack of exercise weakens the heart and the blood vessels. Now we have stress and mental pressure. From financial struggles to career pressure and social media comparison, stress levels are at an all-time high. Chronic stress raises hormones that raises the blood pressure. Then we have obesity and weight gain. Excess body fat forces your heart to work harder. This significantly increases your risk of developing hypertension early. Weight gain, especially around the abdomen, puts an extra strain on your heart. And unfortunately, obesity rates are rising among young adults. Then we have alcohol, smoking, and substance use. Regular alcohol intake, smoking, and even recreational drugs can damage blood vessels and elevate your blood pressure early in life. Energy drinks and stimulants are also becoming a daily habit. They spike your heart rate and blood pressure instantly. Over time, this damage becomes permanent. Then we have poor sleep and night lifestyle. Sleep deprivation, late night, disrupts the body's natural rhythm, and this leads to increased blood pressure. Then we have genetics and family history. If your parents have hypertension, your risk is even higher, even at a young age. Now, here's the real danger. You may feel completely fine, but inside your body, damage is already happening. Untreated hypertension can lead to heart attack, it can lead to stroke, it can lead to kidney failure, and it can also lead to vision loss. Now, these are happening at younger ages. So, we have to give attention to these warning signs. Most people feel nothing, but some may experience symptoms like frequent headaches, dizziness, blurred vision, and even chest discomfort. If you notice this, don't ignore them. Seek medical attention from your doctor. This is what you must do to prevent high blood pressure, or should I say preventive measures against high blood pressure. 1. Eat healthier. Reduce salt, avoid processed foods, and eat more fruits and vegetables. 2. Exercise regularly, at least 30 minutes, 5 times a week. Thirdly, manage stress. Practice relaxation, prayer, or meditation. 4. Maintain a healthy weight. Even small weight loss can reduce your blood pressure. Then, sleep well. Aim for at least 6 to 8 hours of quality sleep. Then, check your blood pressure. Don't wait until you're sick. Make it a habit to check it regularly, even in your 20s. If you are under 40, this message is for you. Check your blood pressure this week. Share this video. It might save someone's life. Thank you.